as an operator, I was like, I'm so excited to think about how do we bring these often siloed pieces of government together in service of healthy communities? How do we create the infrastructure to do it? And it's not just like, integration for integration's sake. It's like for health.
Hey everyone, welcome to Leadership Rounds, a podcast shining a spotlight on exceptional clinician executives thriving and driving innovation at the intersection of business and healthcare. I'm your host, Dr. Reena Pande, and together we'll explore the wisdom and insights of great healthcare executives and craft a prescription for leadership success, one candid conversation at a time.
Mandy, it is such a pleasure to have you on the podcast. Thank you so much for joining. As you know, this has been a bit of a labor of love of mine to have a space to highlight extraordinary clinician executives, clinician leaders. And I mean, you check that box 50 times over. So I was thrilled to have you join us today. So thank you so much.
Well, it's my pleasure. Thank you for inviting me. I'm looking forward to our conversation.
I love it. So I'm a storyteller and I love story. I always loved patient stories and I love people stories. Maybe that's why I'm doing this work now at Oxeon. But I would love to just start with your origin story. I'm going to let you tell your story over time. I think listeners probably know a lot of the nuts and bolts of your story. But yeah, let's go back to the beginning. Like, what's the origin story? Take the listeners back to your early days, and what early experiences or lessons actually shaped the trajectory of your career.
Yeah, well, I love this because it gives me a moment to talk about my mom. My mom was a nurse practitioner before they even had the term nurse practitioner in New York. And she worked in emergency rooms. And where do you see often the broken parts of our system? The emergency room. And so I had an early exposure to knowing that the system, right, air quotes for those of you on this listening audio, that the system wasn't really working for everyone, right? Yeah. Both from a coverage perspective, but also for an access perspective and a cost, right? And the broken parts of it would show up in emergency rooms. And I sort of saw that through my mother's eyes. And then I thought that I wanted to go into medicine, like sort of taking after my mom, but then had this experience working in Washington, D.C. As an undergrad. I worked on the Hill and I got to see how policy was shaping the practice of medicine, right? Through payment, through policies. And surprisingly, back at that time, that was in the mid-90s, there weren't a lot of doctors involved in the process. And so I happened upon an amazing mentor who was still in my life at this time, who was running CMS at the time. This is Bruce Vladeck, who was running CMS. And I met him after a hearing. He was testifying and that I, a little intern covering the hearing. And I wound up being an intern for him as he was leaving CMS. And he was the one who sort of validated for me. I was like, hey, I'm thinking about this career that bridges the clinical medicine and policy and administration. And back then, that felt really radical. Now it's really common and I love it. But it felt, I needed someone like Bruce who had run CMS to say, like, that makes sense. A bridge builder makes sense. And so I ran forward to medical school at Yale, where they really allowed me to explore that bridge building mentality, thinking about being a leader, about systems and about system change, and about the practice of clinical medicine. And then I went to MGH to train, which was wonderful. And that's where you have those amazing clinical experiences with patients where every day you're seeing how the system doesn't work for your patients. You're like, we can do better. And it was, it then became even more obvious that I wanted to go to a place that shaped the system that we were all practicing in. Yeah. I often share a story about a very important patient who I think about often of mine who, to be honest, I did everything wrong, but I did everything that I was trained to do, right? So it was a person who came in, a young woman. Yeah. So this is a woman had insurance coverage. She was a young woman 22, 23 maybe. And she came in because her hair was falling out. Right. And I went through my, everything that we're good at. We asked some hard questions, but what I was really great at was ordering tests. Click, 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 click. So easy, right? In the EHR, order those tests. When the tests were all normal, we're like, maybe something's going, she was complaining of some abdominal distension. Oh, let's do a CAT scan, right? Really good.
Right.
Right. So when the system was working, she was getting tests, but what happened, it was 10 weeks later, I'm seeing her back in the office, and the nurse tech, my LPN who checked in the patient, came and said, I think you really need to ask your patient if she has enough to eat.
Oh, how interesting.
And it was, it's one of those like out of body experience moments. So it was where I was like, oh, I've had this amazing amazing education. I was sitting in Mass General Hospital, amazing system, electronic health records, incredible medical technology. And I missed the boat entirely, right? Because it wasn't built into the system.
Yeah.
To think about that whole person. And it just reinforced for me to be like, how do I do this differently? And I was already on a journey of thinking about government and public service and how it shapes the practice of medicine and shapes healthy communities. But that was one where I was like, that cannot happen again. And how do we create systems to avoid that?
So interesting. So I actually didn't know about your undergrad experience on the Hill and getting tied into CMS even then. So you were, you had that early exposure, which is so cool. But then I get the sentiment, right? To be in this amazing institution, I know it well, and to see it fail. I felt the same in my experience as attending at the Brigham. Just the individual N of one experiences make you really appreciate how broken the N of many system is.
Yeah.
So it sounds like there were early days that you were starting to think from a systems perspective.
And then when it came time to say like, well, where is the biggest lever that is shaping how we practice medicine? You got to, I was like, you got to go to DC, right? And at first, actually, I went to the VA, which was a really good, it was a good first experience. I was thinking, oh, I want to go to the largest integrated health system that has the public service, and this is great. I'm going to do that. And it was a great experience. I actually focused in women's health and thinking about, it was just when women, the first real larger cohort of women in our military were retiring or were moving back into, veteran status, and integrating women's health into this largely male-dominated clinical system. So that was really fun. But what I missed was the payment levers. And I was like, ooh, the rest of the health system is so intertwined with the payment levers. I need to go where the money is, it was my thinking. And it was a time when the Affordable Care Act was getting passed. I was like, there's going to be so much change here. I gotta go to where the change is. It was one of those moments where you're just like, I just need to get inside. So I moved to CMS. I went to the Innovation Center. I was like, this is where it's all happening. And it was amazing. It was an amazing, few years there thinking about accountable care organizations. Again, how does payment drive better outcomes for people, humans, right? We get what we pay for right now, and no one likes it. That's the sad part.
Totally.
So if we change how we pay and what we pay for, can we get both better outcomes, better health, and save some dollars, right?
Absolutely.
From that as well. So that was really exciting.
Go back to the VA experience for a second. I know it was not long, but it was this first leap, right? From the MGH and residency to government, and large complex systems. And, I think people sometimes wonder about physician leaders leaping from the clinical arena into a large complex system of that nature. What set you up for success in that and future roles in massive organizations? And what were things you needed to learn when you stepped from from clinical medicine over to the
Well,
VA?
I think because I was so early in my overall career, I had a lot of humility to say, like, I have to learn. And so, like, right, doctors who might be more mid-career, like the idea of feeling junior
Yeah.
is uncomfortable, and could be uncomfortable for folks. But I was, just out of residency. I kind of was in trainee mindset, really. And so I think I was more open to a role, a role that didn't have a big title or what have you. So one was humility. And then the thing to understand that I learned very quickly was, like, how do you navigate big bureaucracies, right? And still get things done. And I luckily had a boss that was really experienced in navigating bureaucracy. She was a veteran herself. She had come from the city of Baltimore, so she had government experience before, but not VA. But so we were both kind of learning together, and that was fun. So I would say humility in, like, the kind of role, and recognize that you're coming with some skill sets, but you're going to have to build a bunch of new skill sets, right? In terms of the kind of written communications that you'll need, the verbal communications, just the pace of whatever the work is. So having that humility, but then also learning very quickly how to navigate a bureaucracy to get good work done and stay focused, because there's always fires and how do you keep longer term important projects going? And then, so I probably learned that first, but I moved pretty quickly over to CMS. And I think I really learned how to be a public executive, a public sector executive while I was at CMS. And some of that, is opportunity when organizations are in crisis. You get opportunities in your career. And that was for sure what happened to me at CMS. Like, things were hard, and they were looking for people to raise their hand and lean in and jump in. And also, don't be so narrow-minded in thinking, well, these are what doctor in quotes roles look like.
Thank you. Yeah, you tell this great story. I would love to hear more about when Healthcare.gov didn't work. Basically, you were, Marilyn Tapner came to you and said, "Help! Well, can you lean in here to help solve some of these website challenges?" I'd love to hear more about that story. And
yes, probably the most
perfect example of, like, being thrust in an environment that maybe, like, people wouldn't, put the doctor in charge of, right? But a smart, flexible, intellectually capable human can just roll up their sleeves and get it done. So curious how that played out.
100. So you hit it right on the nose, which is, the role that I went for was felt comfortable from a doctor perspective, because we're thinking about changing clinical practice and payment levers in the innovation center. But the organization, when Healthcare.gov was coming online, this was October 1st of 2013. I remember the exact day because I was actually furloughed. So that tells you, like, where I was in the pecking order. It was not very high. Like, I was not even at work that day. But when, like, by noon that day, I got a call from my boss, who you mentioned, Marilyn Tapner, who was like, Healthcare.gov did not turn on today. You come back to the office. And she's like, actually, don't come to the DC office. Go to Bethesda, which is where the marketplace, or Socio, was run out of. Okay. And I basically was there for many, many months until I ultimately was put in the director role of the marketplaces, or the acting director role at that point. But yeah, what they asked me to run were things I had never run before. Like, but what I had shown before was a willingness to jump in and figure out and learn quickly, that I was a good manager, that I was a good communicator, I was a good teammate. I could mix the politics and the policy and the management of people and the need to execute, right? So I had demonstration. She called with a purpose. I had shown some of that, but it also was crisis. And I said, put me in the game. I didn't say, well, I'm a doctor. I don't know if
I've never done that before.
Or the Navigator program really fits with my career trajectory or whatever. like that I predetermined for myself. I just knew my organization was in crisis. I knew my boss needed a leader, and I said, put me in the game. And it was the best thing that's ever happened to me career-wise. Not the best thing ever career-wise, but the best movement
government.
forward.
And we'll talk in a bit about, stepping out of government roles and into the private sector. But it strikes me as deeply entrepreneurial, what you're describing.
100%.
Right? Like, just roll up your sleeves, figure things out, like ask questions, learn, right? Just do what you need to do.
Yeah, fix problems, do every job until you can figure out how you can delegate the job, have clear roles and responsibility for, it's just amazing. And for Healthcare.gov, what was wonderful about it, I got to be around some incredible leaders, right? I was also learning from incredible leaders. So fast forward to the next crisis, which is like the COVID crisis, where I was the tip of the spear. I had already seen what good leadership in a crisis looked like. And that really was helpful to me. But you are totally right about being entrepreneurial in these roles. People think public sector, and they have this sort of, I think, very wrong impression of the pace. The pace is incredible on the public sector side. But everything you're doing is in a fishbowl. Like, everyone is looking at everything you're doing all of the time. And it moves markets, it moves industries, right? So it is major. And so it's a lot of pressure, a lot of visibility, and the pace is in very intense. And you have to figure it out as you go. And I love that about
Sounds
it.
like it.
Yeah.
Just a couple questions here, because you've touched on leadership and learning from great leaders and learning from great mentors. I mean, I'm sure there'll be people listening going, how did you figure it out? How did you get from point A to B, right? And I mean, is it just innate? Like, you just have this DNA for being a smart, intellectually curious, right, flexible human? Or were there people who took you under their wing and said, Mandy, I see something in you. Okay, I'm going to give you this opportunity or that opportunity. How did you get there?
Well, it was both. I mean, it was leaders who threw me into the deep end, but I'm not going to, but it wasn't like they were like, I'm throwing you in the deep end and here's a life vest with you.
Right.
No, it was like, just go. And there was a lot of just figure it out. And luckily this is where there are so many opportunities, even when you're younger, to have leadership opportunities, and you sort of are building those muscles, even before a crisis or a big opportunity. And I talk to folks who I mentor all the time about finding those opportunities. And they could be in totally different sectors. Like, I was very into the performing arts, but I was more of a producer. So of course I was. Like, I wanted to be in charge, right? But those were important moments of leadership and consensus building and managing personalities, but all focus on the same goal, which is like get to showtime, right? And get that show ready to go, show must go on kinds of mentality, right? And so even folks who might be learning in a different kind of sector, those are transferable skills. So there was a bit of that. I also am an avid reader of leadership books and biographies about good leaders, and taking, the best of what I see from those, but still being authentic to who I was. And then some of it is you just learn as you go. You just have to figure it out. I mean, it is. And I was lucky enough then to have mentors who were like, okay, at certain moments to be like, okay, tweak here, tweak there. Let me give you some advice. But it was a lot of, figure it out as you go.
Yeah. I love that. And I'm grateful for those people in my life too. When I made the leap I spent longer in academia. I stuck around for a little while after internal medicine and cardiology. And then I was a little later in life, as you were saying earlier, I was one of these sort of later in life folks who leapt out of the traditional world.
But one of the things I do want to mention to folks in the clinical space, right? A lot of, in those moments, I realized, I'm an operator. Right. And I didn't have language for that actually at the time, just even with all of my reading. Like, I didn't understand that skill set, because sometimes it doesn't really come out as much in the clinical side of things unless you are really getting into the operations of how your hospital, your clinic would have it. And for me, that felt, when I found it, I was like, oh, I feel really comfortable here.
Yes.
And
I found a word that matches like what I feel inside. Yeah.
Exactly.
Yeah. Well, it's interesting, right? Because that's not a word we often apply, right, to physician leaders,
right, to clinicians, right?
But exactly. But I when I talk to folks, I think it's so key to just understand yourself, right? Like there are great physician leaders who are operators and great physician leaders who are not. Like I'm an evangelist. Like I love being out in the market. I love preaching. I love being, can I do Gantt charts and spreadsheets and run things too? Yes. But my energy is derived from being a preacher, from like shaping and market making. But I think for each of us, we have to figure out what drives us, like what brings us energy and what do we do best. And I do think like language comes later, but like the know thyself we should be thinking about all along, like where do we bring our strengths and our gifts and how do we put them together?
And I think there's a perception, particularly in the public sector, that you're writing policies, which you are. Like I had to understand and know and strategize on policies, but it was the execution of those policies that mattered and shaped success or failure. Yeah. I very much saw that as I was secretary when we'll get to the next chapter in North Carolina.
Yeah. Go for it.
So wonderful run at almost 7 years at CMS. After I was running the marketplaces, moved to chief operating, like I had the word chief operating officer. I was like, of course, that's what I had. Right. I was on the more execution side, but I was also chief of staff. And, Andy Slavitt was the administrator at the time. And I really appreciated that he had me have both of those titles to sort of be the bridge between policy decisions and the execution, because I think that's where CMS had fallen down before, was that linkage between the policy and the execution. And then I layer on top of that, what I got to do when I went to North Carolina is layer the policy, the execution with the communications and sort of the political management, right? So when you are the tip of the spear, and I was so excited to go to North Carolina because as Secretary of Health and Human Services, it was more than just I don't want to say just the Medicaid program, which is huge and important, but it put together Medicaid with public health, social services, mental health, early childhood education. And I was so excited going back to that one patient where our system was not integrated for her. I was like, aha, this is my chance.
Yes, go all the pieces together.
Right. And as an operator, I was like, I'm so excited to think about how do we bring these often siloed pieces of government together in service of healthy communities? How do we create the infrastructure to do it? And it's not just like, integration for integration's sake. It's like for health, for North Carolina. And I was thrilled to do it. And I got to, work for, I think, the best governor in the country, Roy Cooper, who really let me paint on a blank canvas of like, how should this work for North Carolina? And we did everything from modernize the Medicaid program. Launch the first integrated social services and Medicaid program called Healthy Opportunities, where we actually use Medicaid dollars to pay for food and housing and nutrition. So you can see that one story played a very big role in my life, but authentic to myself, operator, right? It was like, how do you build structures that can last? So it wasn't just a policy, I'm going to pay for it. We created a data infrastructure in partnership with Unite Us and United Way to really make that possible at the community level. And use policy levers like an 1115 waiver in Medicaid. So you had to know both. You had to go on policy, you got to do the execution, and as the tip of the spear, a communicator of what is happening. And then all of those things get put on display when you get into COVID. Yeah, and then it was COVID.
I cannot even imagine being, the head of the HHS in that era. I mean, tell us a story and just lessons learned. I can't even fathom. I mean, it was enough just being an individual trying to do my day job in that era. I wasn't even clinical anymore then. My husband was. He was going in. He's the cardiologist at Boston Medical Center. And so he felt it from the inside. But then just to be on the policy side of it, and just what a unique experience for you.
It was unique's a word. Yes. It's hard. The hardest thing I've ever done. But the most, like, now that I have ability to look back on it, it's like probably the most important, the most gratifying thing that I will have ever done in my career. And I'm so grateful for that opportunity to put together the fact I'd seen crisis, and I'd practiced that. I understood how to pull different levers of government together. And then it was, again, working for an incredible governor who trusted me to lead the response and share the stage with him from a communication and trust building perspective, and to execute with the team on what needed to happen. And, but it was hard. Sleepless nights doesn't even capture what the weight and enormity of what that was and what it felt like. I hope in my lifetime I will never have to ask businesses to close or for people to not send their kids to school. My girls were in kindergarten and third grade when that happened. Goodness. So I had little kids who were in public school going through it with everyone else. My family was all in New York, right? The epicenter where everything was happening. So I was worried about them and watching the implode. I think we all forget sometimes the implosion of the New York City health infrastructure. And I know how bad it was because my brother's wife and his wife were pregnant at the time and were making decisions about could they even have the baby in New York, or were they going to come to North Carolina? Anyway, it was horrible, and we did not want to see that spread across the country. Anyway, it was just an incredible moment of learning how to be a leader again while everyone's watching.
Right.
Learning how to communicate, luckily I had 3 years of really good relationship building in North Carolina that I was able to draw on, whether it was relationship with the hospital CEOs who were so important, that we acted as one team, or my relationship with the General Assembly, where I needed their alignment with the decisions we were making and the hard decisions, and then building that trust with the people of North Carolina. And I know we did it because we measured it. We measured trust from day one repetitively. And it is one of the only places I've ever seen that trust went up. That we measured trust in me personally. We measured trust in the governor and trust in the Department of Health and Human Services. And trust went up over the course of COVID.
I want to hear more about that. So interesting, because I wanted to get into this topic of trust, actually.
Great.
Trust has diminished, right, over the last several years. And I mean, you saw it in your later CDC role too, right? But in this era of your career, what made you even start by measuring trust? And had you been measuring trust in advance of this crisis?
Yeah. So great question.
What made you even think we should measure and we should track and we should be
all credit to Governor Roy Cooper. He said in February of 2020, I've told this story many times, it was so impactful. I just remember him saying to me, Mandy, our ability to navigate through whatever this is, and we didn't even know what it was going to be in 2020. Right. We stood up this COVID task force. We're like, what is this? He said, our ability to navigate through whatever this is going to be is all about, can we build and maintain the trust of the people of North Carolina? So he said it, and being the operator, I was like, oh, how do I make that? How do I measure? How do I measure that? How do I make that tactical? Right. So first I just was like, oh, well, how do people trust us now? Like, we better start measuring this. Right. So that was one. Right. So the operator in me kicks into gear, and it's also the operator and like the tactical plan.
Yep.
So for me, it was about transparency. So it was like, how do we get our data up on a website as quickly as possible? How do we make sure that when I am speaking that I can say, this is what I know and this is what I don't know, and I'm going to be back at 2:00 tomorrow and tell you more, right? The operator, I wanted that consistency. So the transparency part of trust building was very tactical to us, right? It wasn't a feeling. It was tactical. Second was about execution, right? I think trust is built on good execution, right? If you say things and then you don't deliver results, people lose trust in that. And you're seeing that in the whole healthcare system right now, where words and actions are not matching and people are sick of it and really pissed, actually. Like more than lack of trust, they're angry. And that's going to take so long to rebuild. And so what we thought about, okay, how do you have great execution? So, I put one of my best operators who then took over for me in North Carolina, Cody Kinsley, was like head of operations for all of COVID, amazing operator also, right? So the two of us were a great team. And then I had an incredible policy and communications people, right? Again, you can't do this yourself. You need a team of people who know how to do this. Shout out Cody Kinsley, Tracy Zimmerman, Susan Gale Perry, so many. But that's what you need, right? Is also as a leader, where are your strengths? How do you pull in people who are great at their roles? How do you make sure you have cohesion as a team? Because if you don't trust each other, and the governor and I don't trust each other, there's no way we're going to maintain trust with the people of North Carolina, right? So it was all of those things. So it was transparency, it was execution, and it was relationships. Internally, it was relationships. Externally, it's relationships with the General Assembly. So that was the formula.
Can we talk about team a little bit? I love it that you went there and named some phenomenal people that you had the opportunity to have by your side. But when you're running an organization that's 12,000 people, 15,000 people, the size of the organizations you've led, you can't do it alone. You can lead from the top, but you can't do it alone, as you've articulated. How do you think about hiring? Like, how did you think about building teams? What was your approach to leadership and surrounding yourself with these great people who helped you achieve what you and the organization needed to achieve?
Well, first is I think the most important thing is knowing what you personally, what your strengths and weaknesses are as a leader, so that you are building a team that is complementary to that, and that you're not over indexing for what you already are strong at, and you don't cover your weaknesses. So for example, right, I said I'm an operator. One of the things I know I am weak in is sort of that big blue sky thinking, like what's that next big idea? Like, right, because I'm so often practical, right? I'm going to get it done and I'm going to execute. So I always am making sure on my senior teams that I have someone who thinks like that, who is on the edge of thinking, what about this great? Now they'll come to me with 100 ideas and I'm like, ooh, we can't do all those ideas because we don't have time or money. Right. But I want to hear them. Yes. I want to hear them and I want to integrate them into our thinking. And we're going to take probably 5 of those and it's going to change the trajectory of our future. So that's one, is know yourself. So Absolutely. You know who to put on your team. I think the other big thing about talent is there is also the people you need for peacetime and the people I'd say you need in a crisis, and they're not often the same people.
Sure.
And it's not bad or good, and I'm not judging, but they're not. Absolutely. They're not. Sometimes the people you have in peacetime are great in peacetime and cannot flip into crisis mode, and vice versa. They always want to make everything a crisis. And you're like, no, I need to delegate this down so that the team learns how to solve these problems with themselves. Like, it isn't a crisis. We don't need this at 5:00 on a Friday. Like, I need you to give the team the time to do this work. Right? So you can have it both ways. So that's another. And then I think it's a values fit too, like making sure you're not just solving for skills are important, or I'd say knowledge base is important. But for me, I would say core skills on communication, people management, are more important to me than someone's knowledge base. Cause you can
learn.
You can learn 100%.
Yes.
But I will say, as a physician leader, and I've had a lot of roles, I often I've experienced it in this last year. So let's be like honest. Folks who are like, well, you've only led in the public sector, so I don't think you can do private sector. And I take issue with that because I don't think that's hiring well, meaning that are you looking at what are the core skills and core competencies, and are you just saying, oh, well, you're right, I probably need to buff up on financial terms and private, publicly traded markets. Okay. But I'm pretty sure I could learn if you put good people, if I have good people on the team. Mm-hmm. And so for me, it is a making sure there's a values fit and a core competency fit on communication, and management strategy, those kinds of core competencies as opposed to,
amazing.
Yeah,
that makes a lot of sense. And it's so interesting because we think a lot like that as we're helping teams find great people, right? What does matter more, right? To them, they also have to decide, right? Do you need someone who is bringing the functional expertise, right? I understand
sometimes
Medicaid policy, right? Or this person understands X, Y, or Z. Or, do you need someone who's more agile but can bring like the leadership chops or the management chops, whatever the leadership skills are that you need them to bring. But those are questions like I think that hiring teams need to really understand about themselves too. Like, what are you willing to give, and what are you willing to learn?
Exactly. And I think I've had roles where I'm managing executives, right? So I'm not managing frontline team members often. And so what I'm hiring for are people who are great at that. But my expectations of when I'm managing executives are very different than if I'm managing frontline subject matter experts or individual contributors. And I do think you need both.
Yes.
I try to put on my senior team some people who are free of the management, right? Because that's a skill not everyone has. And sometimes you want people on your team, like I said, who have the big idea people or the strategy, but they're terrible with people. And I'm like, that doesn't mean you're terrible. It's just, I'm not going to put you in a job. And unfortunately, we often conflate the two.
Me too. People feel like managing is the path to greater and greater leadership, right? And I think you just got to know, like, are you great at managing people or not? Or are you a wonderful influencer? And there's a role for those people too. I've held all of those roles in my career. There have been times when I had a baby team and I just had a loud, booming voice across the business, and other times where I had I hesitate to say large when your large is far larger than my large, but in the context of my places was large, right? So, but I've had both, right? And I think you can be powerful and have an impact, both as an individual influencer and as a team leader and manager.
Yeah.
Well, you still have more chapters of your career that we haven't actually unveiled here. People know, but we haven't talked about. COVID comes, and I hesitate to say goes because it's not gone, but you post-crisis then step into another amazing leadership role leading up the CDC. And, this was an era now post-COVID where, to go back to that word trust, we had degraded trust in public health institutions, including the CDC. I'd just love for you to reflect on your time there and what it was like in sort of the post-COVID era. I'll let you tell us that story.
So this is like the thought of like, how do you recover from an organization post-crisis, right? And so how do you embed the lessons learned? And again, think about what new leaders, because I would say it was such a traumatic time that leaders are either burnt out, or they are trying to make everything a crisis when we're out of crisis, or we just need some fresh legs, what have you. So there was a need for CDC very much. My mandate was CDC to change, right? In terms of a post-pandemic learning lessons. And so that was my mandate, come in and make some changes, big changes to the agency. So that involved some personnel changes and involved some really big changes on how the agency did its work. And meaning that it was often very siloed organization. If you worked on HIV, you sat over there. And if you worked on malaria, you sat over there. And if you worked on COVID, you sit over here. Now, COVID brought them all together. So they sort of all were acknowledging, oof, that siloed thing is not working for us. So luckily for me, I didn't need to do a ton of convincing folks that we needed to change. Now they weren't sure like what direction, how are we doing this?
How to do it.
So we had to work on like, here's how we're going to do it. But not everyone was interested in coming on that journey because they liked their work and what they were focused on. And they were like, you know what? I don't want you to take resources away from my thing to help the enterprise. And I was like, well, that's just not how we're going to operate as a team here. And so, there were some folks who I had to ask to leave the team, brought in some new leadership. And importantly, I think when you're doing change management of an organization, I do feel strongly that you need to care for that organization and the people in it in order to change them. Caring for them doesn't mean you're satisfied with the status quo, but I do believe people change faster and will maintain that change longer if they know you care about them. And I care deeply both about the mission of the agency and about the people who work there. I do not think they were bad people. I do think they were caught in a bad system. Again, going back to that systemness that drives me. And so, just to contrast this with some of what I saw from like a Doge perspective, right? That was a, cut first, ask questions later kind of mentality where you could just tell there was not a caring for humans or the mission. But I think we were both similarly motivated by change. Like I was I liked where they were going from we have to rethink this and we have to do this differently and the status quo is not working. Great. Now I mapped that change differently. So I think that you get, like I said, better, faster change, caring. So there was one, as a leader coming into a new agency, I wanted to make sure folks knew that I care very much both about the mission, the work, and them as humans. And then chart a course for the future to say, we're going to do this differently. And here are a few use cases. We're not going to boil the ocean. Here are the use cases we're going to do. Here is the right? People are very tactical. What does this mean for me today? Like, what should I wake up today to do? I don't know what you're asking me to do.
They're not thinking about the system. They're thinking about their individual
Between
role.
9 and 5, what am I supposed to do? What's my role? Right. So getting role clarity is really important when you're changing an organization. Always explaining the why. Why are we changing? Why am I making you do this hard thing that you don't want to do? Right. Why? And then laying it out and like taking bites of that big, the elephant so that we move people along. And I think we were making progress. And now my job was also to repair relationships on the Hill and with the American people, right? So which means I needed a team that was back at the ranch, right, or in Atlanta, doing that change management while I was on the road doing the communication and the vision setting and the rebuilding of trust. So both of those, all of those things needed to happen. So that, it was wonderful. I loved the work. Busy times.
Special. Yeah. Hard, but special and important work. I know we're coming up on time here, so I want to get to this most recent chapter of your career, which was stepping out of the public sector and into the private world, which, as you've already pointed out, there's frankly lots of similarities in the work, different environments, but a lot of similarities. So, tell us a bit about your time at Aledade and then now at Manat and the things that you've had the opportunity to focus on, taking your learnings from, your times in the public arena out to the private world.
So first, I'll touch on Aledade, which I did between North Carolina and CDC. What I loved about it, again, finding an organization that was, really in the intersection of care delivery and payment in service of healthy communities. I was like, yes. I love like the mission of what it was and still is trying to do, to think about how do we pay differently to get different outcomes, right? It seemed like the perfect putting together of all of the things I'd been thinking about on the public sector side and trying to do it from the private sector. So it was wonderful. And again, what I loved about that organization, just as a shout out, is the culture. I mean, wonderful mission, and people who are very dedicated and smart and just kind people. And I just don't want to skip over how important that is. so that was a great experience, and it was my ability to, work closely with a private board, and to, that was my learning environment on all of the financial side, because that was newer to me. So me and the CFO spent a lot of time together just so I could absorb and learn. And we had purchased a business in my role, as integrate that business into the organization. So that was fun, and the people and change management of that. That was wonderful. But then now, as I transitioned out of CDC I said it was going to be the first time in my career where I didn't jump into another operating role. And so, Reena, this was scary for me. This was scary.
How will I not own something?
So I forced myself into that uncomfortable place, and I'm glad I did.
I love it.
Because it allowed me to be in different parts of the health ecosystem. So I could see I was working with states, but I was also working with health systems and tech companies and primary care and all in one day sometimes. And it was really wonderful to just sort of be able to understand how everyone was experiencing 2025, which was a lot, between all of the, changes on the policy front, but, whether it was tariffs or what have you, or just how everyone was integrating all of the AI changes, right? It wasn't just policy. 2025 was like epic from a lot of perspectives. So that was wonderful. And, I've gotten a lot deeper specifically into the tech and AI space. I do think it's going to change how we practice medicine.
Yeah.
But I think we're just in such early innings on the regulatory and payment side of that. So I am very interested both in creating the financial markets so that AI are solving the problems we needed to solve, that actually build healthy communities, right? So how do you think about regulations and market incentives to make sure our smartest and best people are really using this new technology to create healthy communities? So that's one aspect of what I think about. And then how do we pay for this? Like, what is the sustainable model, and how do we maintain trust? So all the themes we've been talking about today. So that is what I spend my time thinking about, as well as help some of my colleagues in the public sector at the state level still think through a lot of challenges that they're going through, and often doing some executive coaching, which is so fun.
I love that. A teacher too at your core, which is neat. I am so appreciative. I have one last thought from you, which is in this era, as we're going forward and having seen like all the pieces of the puzzle in your career, and now the overlay of seeing the impact of tech, AI, data, and innovation. What last words of wisdom perhaps do you have for clinician leaders who might be listening, and how they can be impactful, and what they need to know and think about in this moment of change in healthcare?
Well, one, I don't think tech is going to be our limiter. And what I do think is going to be the limiter are two things. One is change management, right? We're going to have to change how we practice medicine, what we use our time for, how we interact with other team members because of it. And so that change management is major. So I think everything from medical school all the way through your everything, your workflow day. So the change management is what's going to limit that, number one. And then second is trust, this idea of trust, right? Because I think if there is an early mishap with AI and folks, it goes sideways, it's really hard to rebuild trust after that. And so how do you think about maintaining trust on the front end so that the technology can hopefully live up to its potential and solve these problems? We have too many people who are sick and don't have access, and the cost is too high. Like, we have real problems we need to solve. And I think technology can solve some of them, but I do not think we can do it without good leadership, without good guardrails, without good trust building as we go. So those are the things I'm going to stay focused on. And as clinical leaders, I think we have such an important role to play to make sure that we are keeping this technology moving in a direction that is solving the right problems, that is sustainable from a financial perspective, and that is trust, that we are able to maintain trust as we do it. So big challenge ahead, but that's why it's so fun. That's why we all work in healthcare and in health. So it's wonderful.
I love that. It's a perfect ending, and absolutely wonderful way to think about how we go from here forward. Just an extraordinary career, Mandy. It's so fun to just walk through it with you and to hear your perspectives and share the hard parts and share the extraordinary parts of your career. So I'm just thrilled. I will be thrilled to see where you take it here. I mean, this is only the middle of your career. You've already had
so many chapters I want to write here. Yeah,
you've had a lot of chapters already, but I'm seeing several more yet ahead, and it'll be fun to watch your career as it continues to progress. I mean, and just a wonderful example for clinician executives, looking to figure out what they want to be when they grow up. So thank you so much for joining.
All right. Thank you so much, Reena.
Thanks for listening to another episode of Leadership Rounds, where clinician executives share wisdom and insights on what it means to be an exceptional leader in healthcare. If you enjoyed today's discussion, please subscribe, comment, and share with your friends and fellow leaders in healthcare. Join us next time for another dose of leadership wisdom. Until then, I'm Dr. Reena Pande. Thanks for listening.